guys ready?
Yeah.
Okay. Well, I'm going to say knock knock, and that's when you start. Okay. Okay. Knock knock. Hello, my name's Ryan Baker. I'm the physician assistant that's going to be taking care of you today. We're going to do a full musculoskeletal exam. Is that what you were expecting? Yes. Excellent. Okay. We're going to start with inspection of the upper extremities, and we're going to look from the shoulder all the way down to the fingertips on both sides. We're looking for symmetry, swelling, deformity, contours, and any abnormal positioning. We're going to move on to palpation. As I'm palpating, I'm going to be palpating bony landmarks, muscles, tendons, and ligaments for any swelling, tenderness, bogginess, or bony enlargement. I'm going to start here on the left side at the sternoclavicular joint, and then posteriorly over the scapula, specifically the scapular spine, come around to the AC joint and the coracoid process. And take your arm like this, just rotate it back, feeling that subacromial space, greater tubercle, and then the biceps tendon. Come over here on this side, again, feeling that sternoclavicular joint, posteriorly over the scapula, coming around to the AC joint and down to the coracoid process. Subacromial space, it's okay, just relax. Greater tubercle and biceps tendon. And come down to the elbows, laterally feeling the lateral epicondyles or medial epicondyle, ulnar nerve, and over the olecranon process. And come down into the wrists. I'm going to start on this side, feeling both the lateral and medial joint, over the carpal bones, the radial styloid, anatomic snuff box, down into the metacarpals, one at a time. MCP joints, PIP joints, and the DIP joints. Do the same thing over here, in the medial and lateral joint line for the radial styloid, anatomic snuff box, with carpal bones, and then again over those metacarpals, and the MCP joints, PIP joints, and DIP joints. I'm going to be doing some range of motion, okay? I want you to just follow the motions that I'm doing. I'm going to be saying some words for the grader, okay? So we're going to start the shoulder and flex that shoulder up, and then extend it back. Excellent. And then abduct up, and adduct down, and crisscross for me. Perfect. I want you to put your hands like scarecrow, right? We're going to externally rotate and internally rotate. Fantastic. I'm going to be doing all those same motions for you, but then we're going to be we're going to continue with active range of motion. So I'm going to have you put your arms out like this, and we're going to flex the elbows, we're going to extend the elbows, we're going to pronate and supinate. Then at the wrists, we're going to flex them up, extend them down, and then ulnar deviation, radial deviation. Okay, put those thumbs up to the ceiling in abduction, put them down for adduction, extend them out, and then flex them in. Then I want you to do some opposition. Excellent. Take your fingers and flex them in like this, and then extend them out. And then I want you to spread them out like that for abduction, then adduction. Okay, we're going to be doing a lot of those same motions, but I'm going to be doing them for you. So I just want you to let your arms relax, go loosey-goosey, okay? Again, shoulder flexion, shoulder extension, abduction, and adduction. We're going to do some external rotation, internal rotation. We're going to come over here and do the same thing over here. So we're going to go flexion, extension, abduction, and adduction. And then external rotation, internal rotation. Great. Now since we're on the side, we're going to do some elbow flexion, elbow extension, some pronation, some supination. flexion, extension, pronation, and supination. We're going to take your wrist, we're going to flex your wrist, extend your wrist, ulnar deviation, radial deviation, and same thing over here. Some flexion, extension, ulnar deviation, radial deviation. Perfect. We're going to move on to the lower extremity, and for this part, I'm going to have you hop down. And then if you just walk down to like that gray strip and then walk back towards me, I'm observing her gait. And while she's doing this, I'm also inspecting the lower extremities for swelling, symmetry, and deformity. Actually, we'll just keep you standing up for this part. Need a chair. And if you could, I'll have you turn around and face that wall over there. So I'm moving on to the palpation portion of the exam. Again, I'll be palpating bony landmarks, muscles, tendons, and ligaments for any swelling, tenderness, bogginess, or enlargement. I'm going to start here at the iliac crest. Come around to the ASIS, anterior superior iliac spine, posterior superior iliac spine, and the sacroiliac joint. Laterally over the greater trochanter and trochanteric bursa. Okay. Have you turn around for me. Now we're going to do some active range of motion while I have you standing up, okay? So we're going to start with that left leg. You can put your right hand on the table if that helps you stabilize yourself, okay? So we're going to do some flexion of the hip, good. Extension of the hip, abduction of the hip, adduction of the hip. And then if you could just lift that leg up for me, and we're going to externally rotate and internally rotate. Perfect. Now I want you to turn around. We're going to do those same things, but with the other leg. Flex up, good, extend back, good, then abduct, adduct, and then bring it up like this, and internally rotate and externally rotate. Fantastic. And while you're there, we're going to do some active range of motion of your knee as well, okay? So starting with your left knee, I just want you to flex up like this and extend out like that. And then I want you to internally rotate and externally rotate. Excellent. And we'll do the same things on that side. We're going to flex up, extend out, internally rotate, externally rotate. Fantastic. Now I'll have you sit back up on the table. All right, so we've done palpation of the hips. Now we're going to come into palpation of the knee. And I'll start here on the right side, palpating the suprapatellar bursa, prepatellar bursa, patellar tendon, and tibial tuberosity. Coming into the tibiofemoral joint, both medially and laterally, also feeling medial and lateral meniscus. Maybe scoot forward just a wee bit right there. As well as the MCL and the LCL. I'll do those same things over here. Suprapatellar bursa, prepatellar bursa, patellar tendon, tibial tuberosity, medial lateral tibiofemoral joint line, the MCL, LCL. I'm going to come back up. I forgot the femoral condyles, both medially and laterally, the tibial plateaus, both medially and laterally, and the tibial epicondyles, both medially and laterally. And we'll hit those same spots over here. Femoral condyles, medial and lateral, tibial plateaus, medial and lateral, and tibial epicondyles. And then we're going to come down to the ankle, continuing with palpation. I'm going to palpate that anterior joint space. Sorry, that was close. And then over to the medial malleolus. You okay over here? Yep. Lateral malleolus, Achilles tendon, calcaneus, up into the plantar fascia. Good. And then we're going to do those MTP joints, metatarsal phalangeal joints, as well as palpating the grooves between the metatarsal heads. And again, we'll come down here on this side, medial and lateral malleoli, anterior joint space, Achilles tendon, calcaneus, plantar fascia, MTP joints, and the grooves between metatarsal heads. And let's continue with that active range of motion stuff now that you're seated. And you can stay right there. So I want you to point both your feet, yep, like you're pushing on a gas pedal, and that's plantar flexion. Do dorsiflexion up like this, and we'll do inversion and eversion. And then I want you to curl your toes up, that's toe flexion, and then extend them up to the ceiling, that's toe extension. And then I want you to abduct the forefoot by spreading your toes out as wide as you can, and adduct it by bringing it back together. Fantastic. All right, now let's go ahead and have you lie down. Just put it up on the table. We'll do some passive range of motion stuff. So we'll start with this right hip. I'm gonna just relax your leg. I'm gonna do movements for you, okay? So we're gonna do some hip flexion, some hip adduction, some hip abduction. We're gonna come up like this and do some internal rotation and external rotation. And we're gonna do extension a little bit later. And here, hip flexion, hip abduction, hip adduction, bend it up. We're gonna do some external rotation and internal rotation. And we're gonna go to the knee. We're gonna do some knee flexion, some knee extension, and some internal, sorry. You're good. Forgot. External rotation. And on this side, again, flexion, extension, again, internal rotation, external rotation. Now onto the ankle, we'll do some dorsiflexion, plantar flexion, inversion, eversion. I'll be gentle on this side. Okay, dorsiflexion, plantar flexion, inversion, and eversion. Thank you so much. Now, if you could do me one last favor and turn around onto your stomach. And we're gonna do some hip extension. Just relax. I'm just gonna do lifting for you. Good. Hip extension on that side, and hip extension on this side. Fantastic. Okay, you can roll over. And then we're gonna have you stand up again. And if you could stand up and just face that direction. So I'm looking at the positioning of her head and looking at the posture of the neck and trunk. And from the lateral position, I'm also looking at the C-spine, T-spine, and L-spine, looking at the curvature, making sure that there's no increased or decreased concavity or convexity. From posterior aspect, I'm looking at that line between C7 and the gluteal cleft, making sure it's a straight line. I'm also assessing the alignment of her shoulders and the iliac crest, making sure there's no asymmetry while she is standing erect. And then when she is bending forward, can you bend forward like you're touching your toes? Thank you very much. Stand back up. Now I'm going to move on to palpation. I'm just going to have you take one step to the left. Okay. So I'm going to palpate the spinous processes for any tenderness or bony step-offs. Good. And then cervical facets here on the right for any tenderness, and the paravertebral musculature for any tenderness or spasm. And then on the left side, same thing, cervical facets for any tenderness, and then the paravertebral musculature for any tenderness or spasm. Thank you. Let's have you turn around, face me. We're gonna do some range of motion stuff now. We're gonna start with the neck. I want you to look up to the ceiling, that's extension, then chin to your chest, reflection. Okay, look back at me. Let's do some leftward rotation, rightward rotation. Good, left ear to your shoulder, right ear to your shoulder for some lateral flexion. And we're gonna move down to the trunk. I'll have you flex forward towards the ground, good. And stand up straight. Then we're gonna do some extension. Go ahead and look up at the ceiling, but bend your back, there you go, fantastic. I'll have you rotate to the left, rotate to the right, and you've got left lateral flexion and right lateral flexion. And then I'll have you sit back up here. I think the grader now is going to be telling me some special tests.
Okay, let's do a empty can test.
Empty can test, perfect. So for this one, I'm gonna have you raise your arms up like this, and then turn your thumbs down to the ground. And I don't want you to let me push you down, okay? Excellent.
And then let's do the...
Do you want to ask me? So grader's going to say, what's a positive test, and what are you testing?
What is a positive test? What are you testing?
Positive test would be if there's weakness, like she can't resist on one side, and that would indicate compromised supraspinatus tendon. Okay.
Will you do a Neer's impingement sign?
Here's impingement signs. We're going to take just the affected side usually. We're going to put her arm in pronation, and we're going to lift up. And if she has any pain up here in the shoulder while we do that, it's looking at subacromial impingement.
I was going to ask you what you did. And then can we do a Tinel sign?
Tinel sign. So if we're looking for carpal tunnel on this one, so you want to have her watch on this side. So I would tap here at the median nerve, and if she has any reproduction symptoms or like radiculopathy down in thumb, index finger, middle finger, that would be suspicious for carpal tunnel.
Then can we do a Lockman test?
Lockman, sure. Have you lie back for me. Oh, bring the knee up to about 90 degrees of flexion with this hand on the thigh and this hand in the tibia. We're just pulling forward on that tibia. There's no resistance or no fixed endpoint, a lot of movement. We're looking at possible ACL tear.
And then finally, can you do a McMurray test?
McMurray test, fantastic. So we're gonna grab this foot, we're gonna bring it up, we're gonna put her in some internal rotation. I'm feeling that lateral joint line for any clicking, popping, or pain. And then bring it up again, we'll do some external rotation, and this time I'm feeling on that medial joint line for any clicking, popping, or pain. And a positive test would be any of those things, and it would indicate a potential either medial or lateral meniscus tear.
Good job.
Okay, stop. My time.
16:48.
Okay, so I had 3 minutes left, roughly. Questions about any of, did I, okay, so tell me how I did.
You got everything. I thought for a minute you missed the toes, like the forefoot.
Oh, active?
Abduction,
Oh, yeah.
Then you went back and did it, so
Okay.
you've got everything.
Okay, so you can see, like, if you